A large disc herniation on an MRI can look alarming, but the image doesn't tell you whether you need surgery. Your symptoms do. Here are 3 patterns that suggest your back will probably get better without decompression surgery. Number 1, episodic symptoms. I saw a middle-aged man with a disc herniation who was fed up and ready for a surgery. For years, he had struggled with intermittent sciatica. The pattern was consistent. He would get injured at the gym, hurt for weeks, and then slowly improve until the next setback. He had been living the cycle for long enough that surgery felt like the only way out. This is a pain pattern known as episodic symptoms. If you have this pattern, you may have had pain for years, but here's the key. It's on and off. The painful episodes can be severe, but between bouts, you're essentially fine. While it may be tempting to pursue surgery for what promises to be a permanent fix, surgery can only work if it's targeted to the correct pain source. With episodic symptoms, identifying that source and confirming that a surgery exists for it is rarely straightforward. Episodic symptoms are most common with disc injuries. A damaged disc can cause problems in several ways: pressing on a nerve root, creating instability that makes the back go out, or producing structural changes that stress surrounding tissues. The mechanism varies, but the pattern is the same. If you can wind down your pain between episodes, your focus should be on identifying your trigger and avoiding it. For that patient, most of his flares trace back to poor movement mechanics, particularly exercises involving hip hinging. Squats, leg presses, and kettlebell swings were the common culprits. After winding down his pain, we focused on correcting his movement patterns, and he was able to avoid any major setbacks from that point forward. 2, avoidable symptoms. I saw a retired patient who was passionate about cycling. He rode almost every day. It was a cornerstone of his social life, but sitting was his primary pain trigger, and no amount of bike fitting or positional adjustment could change that. I had to give him difficult news. If he wanted a real chance at healing, cycling had to go. He had cycled for so long that he didn't even realize that it was the source of his persistent aching. But once he stopped, he was nearly pain-free within a month. One of the most difficult aspects of healing is the limitations it imposes. There is a widespread belief that healing is about addition, particularly adding the right exercises. But the foundation for healing is actually subtraction, removing every major pain trigger until the spine has a chance to recover. Pain triggers vary from person to person. Back stress comes from some combination of bending, twisting, and loading, and the specific combination that provokes your pain is something only a careful evaluation can identify. But if you can wind down your pain symptoms through targeted precautions, you generally don't need surgery. Sometimes it's as simple as eliminating one aggravating activity. More often, you'll need to improve your movement and patterns in a more comprehensive manner. A common mistake is thinking, if I just get surgery, I won't have to be so careful. The opposite is true. Post-surgical precautions are often more restrictive than anything you'd observe during conservative care. And quality movement patterns and load management are the foundation, not just for avoiding surgery, but for recovering from it successfully. Just as you shouldn't eat a junk diet after a major heart surgery, you shouldn't overload your back after spine surgery. 3, back dominant symptoms. Last year, I saw a college student who had undergone a decompression surgery for an L4-L5 disc issue. The procedure was a laminectomy, a surgery designed to relieve pressure on compressed nerve roots. But here was the problem. Nerve root compression typically causes sciatica, and this patient had no leg pain at all. Predictably, she gained no relief from the surgery. When I asked her what her surgeon had told her, she said she had been advised of this exact risk, but proceeded anyway because neither she nor her surgeon knew what else to do. On evaluation, her pain traced to a combination of instability and overloading near the injured disc. But if you have a disc herniation, or spinal stenosis, and your pain is in the back only, decompression surgery is unlikely to help you. Back only and back dominant symptoms will generally not respond to a microdiscectomy or laminectomy. Back pain in the setting of a disc herniation may arise from facet injury, end plate stress, and disc sensitization. These are structural pain sources, and spine surgery is generally not capable of resolving them. This is why back dominant symptoms are such an important warning sign. If your medical team can't tell you precisely why your back hurts, that's not a reason to operate. It's a reason to get a second opinion. I'm Dr. Jim, helping you decode the spine one concept at a time.